Okay, this is Oscar, and we're going to be doing a complete functional health evaluation. We've already done some blood tests on him. We'll be making sure that we go over all that. And we are waiting on a couple tests that we haven't gotten in yet. Okay. But we're going to do some testing on that anyway. But okay, so tell me about the trouble that you're having.
Yeah, it seems to be gut related. And also with my mood. I'm not sure which started first, but it seemed to be sort of trouble digesting food, maybe. Like
I was reading the notes that you sent from the other doctor, the other tests, and they said it was on the right side.
Yeah. For a while, I had pain on my right side. Maybe I was like my gallbladder probably or something like that. So I went to go get that checked.
And they did an ultrasound on that.
Yeah, they did. Yeah, on this side.
Nothing. Huh?
No, they said everything was normal.
Okay. So I saw that they said it was stomach related in the diagnosis. And then they gave you something?
Yeah, they gave me some medication for it. A couple of them. Not sure what they're called, but yeah, they gave me that, and I took a little bit of it. I didn't finish it because I assumed it was working because I was feeling better.
Okay.
I didn't finish the dosage that you gave me, but I was feeling better. But then it started to kind of come back.
It was a stomach medicine, though. It wasn't like anxiety.
Yeah, it was only for stomach. Yeah.
Okay. 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 And how long ago was that?
So this would have been around early to mid January.
Okay, so not too long ago.
Not too long ago. Yeah. No. Yeah. Pretty recent.
Okay. So what made you not go back to that if it seemed to help to begin with?
At the time, I was taking supplements as well, just like zinc or like iron and stuff.
You mentioned
like that.
Zinc, yeah.
Because I felt like I was getting better, but it was still kind of, I was better stomach wise, but like with my mood, I guess, and stuff like that, it seemed to kind of still be in distress, an issue. Yeah.
Okay.
So I was like, okay, I felt that I was like, okay, maybe my stomach is fine now, but now it's all this other stuff.
Right.
And so like I stopped taking that medicine.
Okay.
And then started focusing on like my mood and that kind of stuff. And
so do you feel like they're related, or you feel like they're kind of separate?
I definitely feel like they're related.
Okay.
Because if I feel like discomfort or whatever in my stomach, I feel like it's connected with like my mood and all that kind of stuff.
Yeah. Do you feel like it make like, oh, I'm having stomach trouble, and that is what sets it off a lot of times, or do you think it goes the other way, or that is it a trigger?
Yes, I think so. Yeah, because when it first happened, I felt like maybe like it was like probably like a panic attack, and that made it worse.
Yeah, sure. You don't know what's happening.
Yeah. And
Okay.
I feel like that could also be a trigger to like, oh, if I feel some sort of discomfort in my stomach, that might trigger maybe like a panic attack or something related to that.
Okay. Do you ever feel like it goes the other way, where like something causes you to have anxiety, like, or a panic, and then it gives you stomach trouble?
Yeah, that's a good question. I've looked at that, and not necessarily.
It seems to go from the stomach. Okay, I see. Okay. And then have you noticed certain foods or like certain things that seem to trigger a certain time of day, anything like that?
I feel like at this point, this is where I'm at right now. I've definitely tried to cut out things like processed foods, fast food.
Okay, great.
Alcohol, that kind of stuff.
I saw they did a test for pancreatitis, but they didn't find anything.
Yeah, they said they didn't find anything either. That's kind of bizarre. But I haven't, besides like processed food, like junk food, that kind of stuff, alcohol, there isn't like an exact food that I've cut out yet, like meats or like vegetables or that kind of stuff. I haven't gotten to that point yet.
Okay. Do you feel like cutting out the fast food and stuff has helped?
It has helped a little, yes.
Okay.
But that leads me to that situation where like it feels like I get symptoms here, and then it's like, okay, that goes away, but then I get other symptoms. So I'm like, I don't even know where I'm supposed to go at this point.
Yeah, sure. And that's one of the mysteries of the body. Like, there's a bunch of stuff that can cause stomach trouble, and there's a bunch of stuff that can cause like anxiety or panic.
Yeah.
And you're like, well, what? I can't stop eating.
Yeah, exactly.
Yeah. So what's the story? What should I do? Yeah. And that's what we're here for today, is to try to nail down what the plan is to get rid of this.
Yeah, exactly. I'm looking forward to it.
Okay. So do you have any other troubles that we haven't talked about? Like, my back hurts, or I have headaches, or I have insomnia or anything like that?
Maybe muscle related in the sense of like, I felt like twitching. Like right now I'm kind of feeling it in my calves or in my thighs.
Like a cramp or like more of a twitching?
More of a twitching.
Okay.
If there's any sensation of like, oh, maybe I might get a cramp, it's in my calves. Sometimes my hamstrings. Let's see.
Does that go along with the stomach trouble and all that, or it's unrelated?
I think so. It does. Yeah. Because like right now I'm feeling a little bit uneasy with the stomach.
Okay.
So I think so. I think it's all connected. Yeah.
Okay. Okay. So you said that you've taken medication before and you said you took vitamins. Have you ever done anything else? Like, I don't know, took antidepressant or anti-anxiety or
None of that.
None of that.
None of that. Yeah.
Okay.
One of my recent appointments, I told the doctor about all the stuff that was going on, and they were recommending, I guess, some sort of not depressant, I think like anxiety meds. Can't remember the exact names.
Okay.
I started low dosage. I was like, I don't think I'm at that point yet, because I don't know exactly what's causing it, and I feel like sometimes if they put you on a certain medicine, then like that might make it worse or that might not help. So I was like, I'm gonna hold off on this for now.
Yeah.
Try to figure out what the root problem is.
Usually it's wise to try to find out something natural instead of going to medications if you can. So your health in general, in general, on a scale of 1 to 10, how would you rate it? 10 being really great.
And I would say currently at a 6.
Okay.
And I'm hesitating because I feel like there's two ways of looking at it. Like what I think, I feel like I'm not doing as well. So I'll say like a 6. But then
because of these problems?
Because of these problems. Okay. But I feel like my actual health would be probably a little bit higher, probably like a 7 or an 8, if that makes sense.
Okay, yeah. Okay. So if you I got rid of those problems, you feel like you'd be like a 7 or 8 or...
Yes, and there have been times where this is stuff that I need to see what helped. I feel like there's certain times where I feel great, like the anxiety is gone, or like the stomach issues are gone, but it's like temporary, and it slowly comes back. So now I'm like trying to figure out what did I do for this to work, or like that
right, sure, yeah. Okay, okay. So if you're not able to get this stuff under control, do you feel like it'll just keep getting worse, or do you feel like it's pretty steady, or do you feel like it's getting better with what you're trying with the, laying off the fast foods and the vitamins and all that? Or
I feel like it's steady, but in my mind, I'm like, I feel like I need to try to get this resolved, or else it's going to get worse. Because I don't know, maybe it's something that I haven't gotten tested for yet, Yeah. And it's like, if I don't address it soon, like in my mind, if I don't address it soon, it's going to get worse,
Right.
So
right. Okay. Well, like I said, we're going to be covering all our bases in regards to the Triad of Health.
Okay.
The first thing that I wanted to do some tests on is nutrition.
Okay.
And it has to do with what you eat, drink, hormones, infections, and prescriptions. And one of the ways that we test is using muscle testing, which your family used to come to me for care when I was in practice.
Yeah.
So you probably are a tiny bit familiar with that.
But, yeah, I remember.
So let's do some test points, and we'll see what that stuff shows.
Okay, sweet.
So I'm going to have you stand.
Yes.
And I'm going to use your arm. Hold really hard, straight elbow, and you just hold it right there.
Okay.
And you don't let me push down.
Gotcha.
Perfect. There's an acupuncture point right here. Hold really, really hard. Don't let me push down. Really hard. Okay. So this point is like a universal test point or circuit breaker point, and it should make your arm go weak.
Okay.
If it doesn't, it usually indicates your body's under more stress than it's handling.
Okay.
So there's something going on that we need to fix.
Gotcha.
to get that testable.
Okay.
Let me grab some stuff. We're going to do the same test again.
Okay.
Hold really hard.
Yeah.
Good. Hold really hard. And like I said, that's the one that should go weak. This is a vitamin that helps you handle stress. I'm going to have you hold that just for now. Hold really hard. Okay, and even that's not working. So let me do a different test. This is for dehydration. Hold really hard. Okay, so see how that one goes weak?
Yeah.
So I'm going to have you drink some more water. Okay. Sometimes when you're dehydrated, it can cause problems. This is something that I kind of had a suspicion on based on your blood tests. Let's see if that fixes it here. Sometimes that's enough to fix it. Hold. Yep, there we go.
Okay.
Try it again. Hold really hard. Good. Double check. Really hard as you can. Okay, that's normal. That's the way it should be. Okay. So there's a couple of other tests that I want to do to make sure our testing is accurate.
Okay.
This is a test point called Kidney 27. Hold. Okay, and then don't turn your head. Keep your head right there, but then look with your eyes over at my hand. There you go. And then sniff through your nose. Hold. Okay, now that shouldn't make your arm go weak. You should be strong there.
Okay.
This is a test, again, for stress handling. And I don't know if you've ever heard of cranial nerves, but they come out through the skull. But anyway, this motion where we have you look sideways and sniff uses a couple different cranial nerves all at once. So it's kind of your brain saying, oh, that's a stress to me, or I'm struggling with that. So I'm just going to tap here. This is a temporary fix for this. Let's double check, look sideways, sniff, hold. I didn't want to catch you off guard. Let's try it again. Sniff, hold. Okay, and then let's double check this. Hold, hard as you can. Yeah, sometimes that happens. Let's double check here, hold. Okay, and then double check here, hold. Really hard. That's not it. There's something else going on. Hold again. Okay. Follow my fingers with your eyes, just your eyes, not your head. Sniff again. Hold. Okay, this is another thing, same sort of test, but a little more in-depth. Okay. Because you're actually moving your eyes instead of just looking sideways. Right. So we're going to tap again, same thing. And this just is kind of a reset. And again, follow my fingers with your eyes. Sniff, hold, good. And then put a hand over your belly button. Is that over your belly button?
Yeah, right.
Okay, hold really hard. Try it again. Okay, and that's normal. Okay. And if your arm gets tired, we can swap. Okay. So let me know. Okay, so let's make sure that you can take that away. Let's make sure we're working right here. Hold. Okay, there we go. Good. So that's how it should be.
Okay.
Okay. So all of that just to get you to the point where you're testable. So basically what this is telling me, there's a bunch of different things going on. It's telling me your body's under more stress than it's able to handle. So and there's two ways to approach that. One is, hey, let's lower your stress level.
Right.
The other is, let's raise your body's ability to handle stress. And I recommend trying to do both.
That's what I was thinking, yeah.
Yeah.
Like both of you.
So, yeah, because you got to handle, everybody's life has stress. You got to be able to handle it. Exactly. So, that being said, let's get started on some of these tests. And again, if your arm gets tired, let me know. Okay. This is for protein. Hold. Close your right eye. That's for vitamin A. Very good. This is for potassium, sodium, trace minerals. Okay. This one is, and I brought this bottle down because I wanted to test you for it. Do you mind grabbing us the open one? Okay. And maybe a couple of little shot glasses for full of water with a little bit of water in. This is trace minerals.
Okay.
Hold really hard. See how strong you are?
Yeah.
Set that down. Hold really hard. And see how that changes?
Wow.
Yeah. It changes pretty significantly. This is one of the reasons I brought this down is I thought you would have trouble with this.
Okay.
The reason I thought you'd have trouble with this is one of the main symptoms that people get when they are low on trace minerals is they'll get like anxiety or like panic.
Yeah.
Or like me, when I'm low on trace minerals, I have a really short fuse. Like I'll get mad in a real hurry.
Yeah.
You've heard of, thank you, honey. I appreciate it. Okay. We're actually probably going to take some here in a minute. I'll take some with you.
Okay.
Yeah, they taste horrible. So you'll see here in a second.
Fine, yeah.
There's macro minerals, like, calcium is a macro mineral, like you need a lot of it.
Yeah.
Trace minerals are minerals that you only need a trace amount of, just a very, very small amount, but there's lots of them. And if you don't have them, then a lot of times, like your nerves don't work right, and there's some other issues that go along with it. Things just don't work right in your body. Let me put this halfway in here. Yeah, that's about right. So trace minerals, it says a quarter to a half a teaspoon. I usually just kind of give a little squirt in there. And I haven't had trace minerals in a couple days, so I'm going to have them with you. But the reason we just get a small amount is it really tastes bad.
Yeah, I've had some before.
You have?
Yeah,
okay.
Yeah. My mom has some.
And then you just shoot it down and then you usually drink some more water. So, but yeah, they have a real minerally flavor to them. But if you want to, have some more water. But
definitely feel more awake and alert though.
That's the other thing that I'll have a lot of, and a lot of people have when they're low in trace minerals, is they'll be like, I can't wake up, I can't get enough sleep, I'm tired all the time.
Yeah.
So I'm going to give you this bottle to take home.
Okay.
Because you should be taking this every day to some degree.
Okay, gotcha.
So that being said, trace minerals is one of the things that was a red flag when you called me and said, hey, can I get looked at?
Okay.
Okay, so trace minerals, this one is for vitamin E. Let's double check that we're still testing properly. Perfect. This one is for iodine, calcium, vitamin C. This one is probiotics, zinc. Where's your belly button? Right there. Magnesium. Touch your tongue for me. This is B complex. Okay. This is something that kind of showed up with the blood tests as well. So we'll go over that. Vitamin B, B complex. There's lots of different Bs and they do lots of different things in the body, but we'll do some more tests that relate to that too, but that's showing up. This one is for iron, D, and like I said, zinc. Now the blood test showed that you're possibly low on zinc, but you said you take it.
Yes, not every day, but recently I have had in the past week.
Okay. Okay. Let's move on, and we're going to do organs now. Close your right eye again. This is for eye. Good. That is the same test as vitamin A, and the eye needs a lot of vitamin A to function properly. This is for lung. This is for heart. This one is for liver, gallbladder. Try it again. Gallbladder. Okay. Do you don't ever have headaches?
No, not necessarily.
Okay.
During all this, not really.
Okay. And you said that you did a test with the ultrasound and they didn't find anything.
Yeah, they said they didn't find anything.
Okay.
And that's where like that pain was whenever I went to
Is that upper right quadrant.
Yeah.
Okay. Okay. Well, I'm finding that your body's telling me gallbladder, and there can be a lot wrong with it before it shows up on an ultrasound. So let's keep going. This one is for small intestine. Very good. And then I'm going to do what are called hand modes. And there was a Dr. Beardall, and he discovered that different positions of the hand relate to different problems in the body. Okay. This one is for parasite. This one is for candida. This one is for bacteria, virus, candida. Okay.
I had a hunch about that, of a candida.
What made you think that?
I don't know if you remember, it was a while back in 2020, I came in for a similar problem to see you. And I think at that time it was also kind of candida related.
Okay.
So I was like, this is kind of a similar situation. I wonder if it's like candida again.
Same sort of thing.
Yeah.
Okay. So usually if you have a candida overgrowth, it indicates your diet is like heavy on the carbs, like pasta, bread, cereal, tortillas, chips. I don't know. Does that sound right?
Yeah, that sounds pretty much accurate. My diet before all this happened.
Okay.
Because like I said, I like a lot of junk food and stuff like that.
Okay.
For lunch, I would just get on takeout or whatever.
Yeah. So what do you eat now?
Right now, it's more homemade stuff, like chicken, homemade like beans and rice and pastas.
Okay.
That kind of stuff.
And great. I'm glad you're doing it homemade, because that's way better for you than fast food for sure. But still, like rice and pasta, even if it's homemade, is gonna contribute to candida, because when you eat them, they digest down to sugar eventually.
Right.
So anyway, we'll touch back on that. Okay. This one is for stomach. And then because you're having stomach trouble, I'm going to do a couple tests that are more structural related, but I'm going to do it while we're doing this. Okay. This is a test for a hiatal hernia. I'm going to pull down twice kind of hard, and then I'm going to push here. Okay. So I'm just going to give it tug twice and then push here. So I just don't want to catch you off guard. Hold. That is very good. I'm going to do the same on the right-hand side. That's good. You don't have that problem. So
that's good, yeah.
One more thing not to have. That's good. This is the large intestine, and we're going to do the same test with the hand. Candida. This is very good. So it's showing up that you don't have candida in the large intestine. Okay. Now, it usually will start in the small intestine. So I'm glad we're catching it here, or maybe you got rid of it from changing your diet to some degree. I don't know. Yeah. But that's not showing up at all. Okay. So bonus. Sure. Okay. This is for bladder. And then prostate. What am I missing? Kidney. I'm going to do the same test back here. Great. Okay, now we're going to switch gears again, and we're going to do your endocrine system as like hormones. Okay. So this is for brain, pituitary. Okay. Have you ever heard of the pituitary gland?
By name, yeah, but not super familiar with it.
Okay. They call it the master gland in the body, and it controls a lot of other glands, or helps regulate them. Okay. However, one of the things that the pituitary kind of is known for is helping to make or relate to serotonin. Have you heard of serotonin?
Yeah, I remember that.
Okay. And serotonin's that hormone that's like, everything's great. I'm fine. Everything. I'm happy. All is well. Yeah. So that may be an indication that you're having trouble in that area, which might relate back to the trouble that you're having.
That makes sense, because I feel the opposite of that. Like, everything's
the opposite fine. Of everything's fine.
Yeah, pretty much.
Yeah. So anyway, and there's stuff to do about that, and this kind of brings something up. There's like there's like hardware, just like a computer.
Right.
You know, you got hardware.
Yeah.
And you got to have good hardware for your computer to run right.
Mm-hmm.
And the hardware for the body is like the cells and the brain and the nerves that all talk to each other and everything's working, you know.
Okay.
Then there's software. And the software is what the hardware uses to run right. Mm-hmm. And the software with people is like emotion.
That makes sense.
Like, you know, I have anxiety because of not because of a hardware issue, but because of a software issue because I'm triggered or whatever.
Yeah,
you know,
that makes sense.
And we need to address both hardware and software to make it so we get rid of this. Because if, say, we just have you lay on the couch and talk, and you know, we just talk and oh, I feel better when we're done talking, but you still have this pituitary problem. You're still going to have trouble. If that makes sense.
That makes sense. Yeah.
And same thing, and we'll test for emotions here later. But if we have triggers that cause you to be anxious, but then we address the pituitary, but not those, you know, you got to address a holistic approach. So anyway, this is for thyroid. Great. This is adrenal gland. That's very good. This one is very common, and you don't appear to have that. I'm going to do another test. This is a different test for adrenal gland. I'm going to give a tug on your arm twice, and then I'm going to push on this one.
Gotcha.
Hold. And that stresses out the ligaments, which the adrenal glands relate to that. They help make connective tissue, but you don't appear to be having trouble there. So very good. Very good. This is testicles. Very good. Okay. Now I'm going to do one more test that relates to them all working together. So just leave this right here and I'll come back and push on it. So this is pituitary and then thyroid, adrenals, testicles, hold. Okay. And that part's good. Okay, so great. All right. While we're on this subject, I'm going to do a test on vegetable oil. Vegetable oil has high omega-6 fatty acids, which you're taking omega-3 supplements already. But, and this is the test that hasn't been performed yet by the lab. We haven't gotten that part yet. But I want to see how you test with it as well. So, hold. I'm going to hold this over brain. Okay. So this is kind of important. It has to do with, this goes back to the hardware thing. Let's hold this over your heart, over your gut. Okay. You brought your omega-3s.
Yeah.
Let's grab those.
Shoot this one.
And everybody always asks me, and you might ask too, well, how does just holding it up against me help? And they found everything has a energy field around it. And this is just a depiction of that I got off the internet. But, you know, molecules have like electrons and protons and all of that. All molecules have an energy field to a tiny, tiny amount. And if we put something in your energy field that's bad for you, hold, your body says, I don't like that stuff. Now, what I'm going to have you do is we're going to test here, and then I'm going to have you grab that and see if this is, in fact, helping. So hold really hard. Okay, grab that stuff, your fish oil, and just hold it. Yep. Hold it like next to you. Yeah, there you go. Hold. Okay, set that down again. Try it again. Hold. And you can see a difference there.
That's crazy.
It is crazy how that works. It really is. There was a Dr. Goodhart. He figured all this out in the 60s. And it's been expanded, and now it's used. This kind of muscle testing is used all over the world now. You sent me a picture of this earlier. 2,400 milligrams in 2 gels, so they're 1,200 a piece. That's pretty good.
Okay.
That's pretty good. And according to the test, this stuff is working for you.
Okay, sure.
But according to the test, you're probably not taking enough.
Okay.
And then the other thing is, I'd like you to get away from sources of omega-6s, which if you're staying away from like fast food and junk food, that helps a bunch.
Okay.
Because that's a significant source. But the other things that aren't considered junk food are things made from grains, like bread, pasta, cereal, tortillas, chips, all of that kind of stuff. Because grains have a large amount of omega-6s in them.
Okay.
So if we can avoid those, and I'll go over all that with you. So let me talk about the cell membrane just real quick with you.
Yeah.
So here's your cell membrane. I'm no artist, but here's another one up here. And say these are nerves and they're trying to talk to each other. This one sends an electrical signal down, and then this nerve at the end squirts out serotonin. Okay? And then it goes across, and these cells have receptor sites on them, and you've heard of this.
Yeah, this is familiar.
Okay, great. The serotonin goes across, and it like sticks in the receptor site, and once enough of that happens, then this cell says, oh, well, that cell is trying to send us a signal, so it sends the signal on.
Okay.
And that signal with serotonin is like, everything's great.
Right.
But it could be like something else, like, oh, I see a bear that's attacking me. Well, that might be adrenaline instead of serotonin.
Right.
And then it's a different response by the body, and that's normal. That's the way, this is how things should be.
Right.
Here's what should be, is you should have a balance of omega-3s and 6s and 9s, and that makes your cell membranes like pliable and normal. Everything's balanced and everything's normal. But when you have too many omega-6s, you get too many 6s in your cell membrane, then what happens to the receptor sites is they kind of get like bent.
Okay.
You got all these omega-6 fatty acids that are just kind of bad. So the serotonin comes along and it says, oh, I can't attach to that bent receptor. So one of the things that we're seeing is your pituitary isn't producing enough serotonin, but also your cell membranes have too many 6s.
Okay.
So you've got this kind of double whammy.
Yeah.
And so far, all of this is just hardware.
Okay.
We talked about the hardware and the software.
Yeah.
All of this is just hardware. Okay. Like your hardware is not working right.
Yeah.
If that makes sense.
It does. Yeah. It does. Yeah.
So anyway, this is why it's so important to. The cell membrane is where basically everything takes place. Because let's say it's not serotonin, let's say it's insulin that's trying to do the same thing. Well, then you become insulin resistant, and then you become diabetic. Okay. Or it could be, any number of other things. You can have this same thing with dopamine, and dopamine is kind of that reward thing. And now I'm addicted to food, or I'm addicted to video games, or whatever. It can cause problems in a lot of areas.
That makes sense.
So we want to really address this hardware issue. So hopefully we'll fix that part of it. Yeah. And then the other stuff, I'm not going to say that the emotion stuff is easy to deal with, but I was just talking about that. Okay. So I'm going to use your printout with the emotion thing and do a couple different tests on you that relate to stomach, because you mentioned having stomach troubles, and this is a test for dynamic consciousness repatterning. They found that different emotions can be caused by different feelings or different different emotions that you have can relate to different problems in the body.
Yeah.
So I'm just going to read some of these off, and this is like asking, this is more software.
Mm-hmm.
This is like asking, hey, is any of this programming in your brain, in your computer?
Yeah, kind of like your subconscious.
Yes, exactly.
Yeah.
That's exactly right.
Okay.
Yeah. So these are related to anxiety.
Okay.
Hold. Feeling unable to call the shots in life. And that's your body saying, nope, that's not a problem. Feels boxed in. Feels helpless to affect a change. Very good. These relate to depression. And this is out of a book that is really a great book. It's called Feelings Buried Alive Never Die.
Okay.
And like, you know how people bury feelings inside? If you do that, they just sit there and fester.
It's not healthy.
No, it's not. It's not at all. You're absolutely right. These relate to depression. Feeling I'll never be able to be enough or do enough. Feeling it's no use. Feeling things are beyond my control. Feeling hopeless or helpless. Feels like quitting or giving up on life. Not relaxed enough to give of your knowledge. Okay. No, I went through it and wrote down everything I thought, but let's do a couple more. I might get the book here in a second. This is a test point to see if any of this is showing up for emotional.
Okay.
This is for stomach. Okay. So see how that goes weak?
Yeah.
So that's like asking your body, hey, is some of the trouble you're having with your stomach emotional? So I'll grab that same book here. My wife has actually gone out to grab it, and I had a copy in here, but here she comes.
I was probably switched arms now just because it's getting tired.
Yeah, no problem, no problem.
Make sure it's still accurate.
Yeah. Like my granddaughter put some stickers on it, and I've used this book so much it's all tore up, but it's, like I said, I use it all the time.
Yeah.
Let's double check here. Hold. Very good. Make sure you're testable on the right side. That's exactly how it should be.
Sure.
So let's go to stomach. Let's see. Okay, these relate to stomach problems. Sense of security feels threatened. Fears new ideas. Lack of affection. Condemning the success of other people. Unhappy feelings. Okay. So this is, again, subconscious. This relates to work. This relates to family. This relates to yourself. Okay. So let me write this down.
Yeah.
And I don't test for stuff we can't help. It's not like, well, you got unhappy feelings, good luck. There's always something we can do about that. And we'll go through a bunch of these techniques before you get out of here.
Okay.
But let's see. So the fix for this, I'm going to tap heart and brain, which are emotional centers, while I'm repeating that phrase a number of times. And then we'll do one more test.
Yeah.
Unhappy feelings, unhappy feelings, unhappy feelings, unhappy feelings. And this is kind of like bringing that file in your subconscious to the desktop of your computer.
Okay.
And this next step is kind of like hitting delete to try to get rid of it.
It's all interesting stuff.
Sorry?
I'm saying this is all interesting stuff. Like,
oh, yeah.
Very intrigued by it.
It's amazing how the brain works and files stuff away. And, who knows when this is from. And so many of these things are formed like before 5 years old. We're at 5 years old, you're like, I'm trying to figure out how to live here and how to survive. And so you pick up stuff and file it away. Just your brain's just like an open book. And you just file it away. And when you get to be an adult, a lot of that stuff that was important at 5 is not true anymore even, So look just with your eyes. Yep. Hold. Good. Hold. Good. Okay. So have you ever asked somebody a question and they kind of look like this, or they look up like this, or whatever?
Yeah.
They found that when you access different parts of your brain, you actually move your eyes in different directions.
I think that's what I've been doing too. Every time like you're talking, I'm trying to process it. I'm like looking a certain way because like I'm really trying to think about it. Yeah.
Using your brain.
Process it,
Yeah. So we've brought that up on the desktop of your computer by tapping it in, and then this next part is like hit delete.
Okay.
So just follow my fingers just with your eyes.
Yeah.
Just real slow. And I'm watching your eyes. They kind of quiver. It's called nystagmus. It's a very mild case, but it's usually an indication that we're not done yet. So I'm going to keep going.
Yeah, I was like, I'm feeling it, but now I'm slowly getting used to it.
Yeah. Okay. This is a technique called emotional release technique.
Mm-hmm.
And it was taught to me by a doctor in Missouri. His name was Rollo Pinnell. It requires you to like think of an emotion that might be triggering to you or something that might be upsetting to you in some way.
Right.
You don't have to tell me what it is.
Yeah.
But what I want you to do is think of an emotion that you've had that you don't want to have, and it causes you anxiety or panic or whatever. Maybe it's my stomach, or I don't know, whatever. It could be, it's up to you, whatever that is.
Yeah.
Do you have one in mind?
Yeah, I do.
Okay. So on a scale of 0 to 10, 10 being like, oh my gosh, this is the worst feeling I've ever had. And 0's like, oh, it's not even there. Where would you say you are with this?
I would say right now 8.5.
Okay.
Yeah.
Okay. So great. You're at 8.5. What I want you to do is picture like carrying a really heavy backpack.
Yeah.
Okay. And I'm carrying this around and it's pushing down on me and pushing down on me. And then have you ever done that? Like carried a heavy load?
Yeah, definitely.
Yeah. And then you set it down, or you're at your destination and you're done, and you set it down, and it almost feels like your body's almost like lifting up because it's like the weight has been lifted off of me.
Mm-hmm.
You know what I'm talking about?
Yeah, that sense of relief.
Yes, exactly. Yeah. So with that emotion, and that sense of relief is letting it go,
right?
Or release.
Yeah.
Could you just let that feeling go?
Okay.
Would you let it go?
Yeah.
Okay. When would you?
Right now.
Okay, great.
Yeah.
Great.
Instantly,
great.
for sure.
That's great. And if you can't let it go, it's okay.
Mm-hmm.
So get that feeling back. What it was an 8.5 before. What would you say it is now?
Definitely feels lighter.
Okay.
Probably like a 6.
Okay. And sometimes it can be kind of hard to rate.
Yeah, slow. It feels like it's slowly declining.
Okay. And don't just tell me that because you want me to be happy about it.
Yeah.
Let's go through it so you really
I'm being honest about
get the program. Okay.
Yeah.
Because I want you to be, what my goal is that you can do this, maybe it'll take some practice, but you can do it on your own. Mm-hmm. and implement this anytime that you're in a situation where you're like, I have a feeling that I don't want to have right now. And so I know I can get rid of it using this method. Yeah. Especially once we get your hardware right. Yeah. If that makes sense.
Yeah. This is kind of like in the sense of like learning to control your emotions and like
exactly
your thoughts and all that.
Exactly. Yeah. So get a hold of that feeling, the same one.
Yeah.
Could you just let that go?
Yes.
Would you?
Yes.
When?
Right now.
Okay. Yeah, put that backpack down. Yeah. Okay. What would you say it is now?
Drop down to like a 4 right now.
Okay. Okay, great.
I feel like I physically feel that sensation of just like, all right, I let it go.
Like, yeah. Okay. The same feeling, You got a hold of it? Like you can feel?
Yeah.
Okay.
It feels lighter, smaller.
Okay. What would you say it is now? You said a 4.
Well, yeah.
Okay. So could you just let that 4 go?
Yeah.
Would you?
Yes, I would.
Okay. And then when?
I'll do it right now.
Okay. Okay. What would you say it is now?
It's pretty near there. It's like at 1 right now.
Okay.
Yeah.
So pretty near 0, like a 1.
Yeah.
Okay. And you don't need me to ask you, could you let it go? Would you let it go? When would you?
Yeah.
All you have to do is ask yourself those questions.
Yeah.
And if you're in a situation where, like, when you called me last night or you text me and you said, hey, I'm having trouble. Can I come either tonight or tomorrow? I was like, oh, I'm not ready.
Yeah.
And I had that like, oh, what do I have to do to get ready? I got to get all this stuff printed off and I got to make a PowerPoint because it was a bunch of stuff that I was like not ready for. And I've practiced this so much that I've gotten to the point where it's like almost I can jump from like, 8.5 down to practically 0.
Okay. Yeah.
By just okay.
Yeah.
And I didn't even ask myself those questions anymore.
Yeah.
It's almost like I feel the feeling of letting that emotion go, and now I'm fine.
Yeah, like second nature now.
Yeah, exactly.
Yeah.
And it took me a while to get there. It really did. So keep that in mind. But this talks about exactly how to do it.
Yeah.
But that technique, and you can do it. The more you do it, the better you'll get at it. It'll get to where it's like easy.
Yeah.
And emotions are a lot like I put these up here because I was going to talk to you about them. But emotions are a lot like tying your shoe. You're 5 years old and you're like, oh, I can't tie my shoe. I've never done this before. I don't know how to do it. But now, you're 6 and you're like, and then, now you don't even think about it.
Yeah, you build that habit.
Exactly. It's a habit. And it's not like your fingers know what to do. It's the neurology. The nerves know I've got to fire these muscles, and this is all, again, subconscious. Your brain doesn't even think I got to fire this muscle in my hand and this muscle in my hand to get my fingers in the right position to do that thing.
Yeah.
It's just like, and you're done.
Yeah. Could it be kind of like neuropaths, sort of? Or is that kind of different? Neuropaths?
Like nerve pathway?
I think so, yeah.
Yeah, yes, exactly. Like it's kind of a nerve habit.
Right.
Yeah, exactly. Okay. And the more you do the habit, the easier it is for you. Yeah. So you like, okay, I got to cross my laces, and then I got to put the rabbit ears together, and then I got to cross the rabbit ears over, and then I got to pull one through the other, and then, oh, now I'm done. Yeah. And now you don't even think about any of those steps. Your brain just does it. Or just like driving home, like when you're in a situation where you first learn to drive, like, oh, and
that's definitely me.
Yeah. Oh my, this, and then are there cops? And oh my gosh, it's like anxiety ridden.
Yeah.
But after years of driving, you might drive home from work, and you get home and you're like, I don't even remember driving home. Your body just did it. Just, and you didn't run through any stop signs, and you didn't run through any red lights. You did it all perfectly.
And sometimes I'll second guess myself. I'll be like, did I run a light? I don't think I did, but I can't even remember because it was just all,
And when you have these neurological habits, they're good because let's say you had to relearn to tie your shoe every time you did it. You'd never get anything done in the day.
Yeah.
Or awesome. I have to relearn how to drive the car every time I turn it on. You'll never get anything done. But sometimes they actually work against us because you can have the same thing. I see something that causes me to think of this other thing that happened, and then I think of this other thing that happened, and then that makes me have anxiety, and then that makes me panic, and then that makes me have more anxiety, and then you can get into these loops too. Okay. And what you have to do is be like, oh, I feel that feeling, and then and then get to the point where you're like, okay, I've practiced that technique enough where I feel really comfortable with it. I know how to get myself from that 10 or 8.5 or whatever it is down to a 1 or a 0,
Right.
and I can do it.
Okay.
And then you don't even have to consciously think about it almost. You can just be like, I'm just letting that feeling go that I don't want to have.
Mm-hmm.
And a lot of people have said to me, well, I use that anxiety to make sure I get my goals accomplished. But you can work on your goals and not be like, oh, I gotta have my goal.
Yeah,
I'd
rather have the latter. Yeah, do that instead.
Yeah,
Instead of using my
you're
anxiety.
way better off, because it's not like you can't get your goals.
Yeah.
You still can acquire them.
Mm.
You can be in a situation where you actually acquire them more. Because, I want that. Let's say you're in high school and you want to date that girl, and you go up to her and you're like, I really want to date you, and I want to date you really bad, and I really want to. That anxiety that you have about the situation is not helping.
Yeah, definitely not. Yeah.
But if you're like, if you want to go out sometime, that'd be great. And if not, then I understand.
Yeah.
And it's the same thing with like, oh, I want that promotion at work, or, you're always better off not having anxiety around that problem, if that makes sense.
No, that doesn't make sense. Yeah, all this stuff, like, I'm pretty familiar with. I could talk about all this stuff for days. So yeah.
Okay.
It's definitely clicking for me.
So what you need to do is get the technique down so you can apply it at a moment's notice. And that does take some practice.
Yeah, I can. For sure.
But you can see the power of it, like, I'm thinking of this anxiety causing problem, and it's 8.5. And within 5 or 8 minutes, we had it down to a 1.
Yeah.
So, if you could even do it quicker, even better.
Yeah, for sure.
Let's do a couple other techniques.
Okay.
Let's have you stand.
Yeah.
Is this arm better?
Yeah, we'll do this one.
Okay. Hold really hard. I'm going to make sure we're testing properly. Perfect. Okay. This gets into conscious and subconscious both.
Okay.
Say, I love myself.
I love myself.
That's really good. I deserve to be healthy.
I deserve to be healthy.
That's really good. That's great. I forgive myself.
I forgive myself.
Okay, see how that one goes weak?
Yeah.
Okay. Now, I don't need to know what you're not forgiving yourself for, but a lot of people have this. And, all the stuff you've done in your life more than anybody else does. Mm-hmm. And so many people are in a situation where they think about that stuff on a regular basis, and then they're in a situation where they have anxiety about that.
Yeah.
When you are in a situation where somebody's done something bad to you, they were mean or horrible in some way, and I can't forgive that person. Mm-hmm. And then you have this like, oh, I'm mad at them. I can't forgive them. It creates problems with you. Mm-hmm. And, that person probably doesn't care.
Yeah.
They were mean anyway.
Yeah.
So not forgiving is only hurting you. Mm-hmm. But when you're not forgiving yourself, you're hurting yourself by not forgiving yourself, but then you're hurting yourself by hanging on to that, mad at yourself. Yeah. Instead of being mad at somebody else, you're mad at yourself and you don't forgive yourself. You see what I mean?
Yeah.
It's a bad situation.
Yeah.
So in order to fix that, here it is. We recommend what's called dynamic consciousness repatterning.
Okay.
Now you can use the technique the emotional release technique that we just talked about, where we went from an 8.5 down to 0. You could use that one and say, okay, I'm mad at myself. I don't forgive myself. And if you think of, I don't know if it's subconscious, but anyway, it doesn't matter. You could be like, I'm not forgiving myself, and it feels like, that 8.5 or whatever, and you can release that as well. And I would encourage you to do that. This one takes a more direct approach.
Okay.
But a lot of times it's a situation where you need kind of a guide. This sheet is kind of a guide, and this is included in the AccuSmart program too.
Okay, sweet.
So there's acupuncture points here and here. Do this. They're right here.
Okay.
So roll them just a little, and then tap, 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 tap. You just keep tapping, and you're stimulating these acupuncture points, and say 3 times, I totally and completely forgive myself.
I totally and completely forgive myself. I totally and completely forgive myself. I totally and completely forgive myself.
Perfect. And then right below the pupil on the bone here is another acupuncture point, and tap that one kind of in right below the pupil. Yep, there you go. Perfect. And be thinking about the problem or what you might not be forgiving yourself for, or what the issue might be. Great, that's good. And have you ever heard you've heard of affirmations?
Yes.
Okay.
Yeah.
This is kind of like affirmations on steroids, because you're using acupuncture to get it into your subconscious.
Okay.
So, I forgive myself.
So I forgive myself.
Okay. Great. Say, I totally and completely forgive myself.
I totally and completely forgive myself.
Okay. Very good. Okay. I asked, I deserve to be healthy already, didn't I?
Yes.
Yeah. Okay, great. So again, this technique you can use for practically anything that you want to accomplish as well. I want to be fit and healthy. Or you could use it for almost anything.
Yeah.
There's a number of prompts here that are very common. Some of these I tested you for, some I didn't, but going through these, and if you read any of these and you're like, that one sounds like something I should work on.
Yeah.
All you do is plug it in and use the same method.
Okay.
Electroacupuncture is the next thing, and I'm going to send this home with you. And on the program online that you'll have access to is a book that you can download that has all the different symptoms in it. There's like close to 100 symptoms.
Right.
And if you, it's in alphabetical order, and if you look up like anxiety, depression, it is, I think it's under depression, anxiety, I think is what it is. But anyway, there's acupuncture points that acupuncturists have written down over thousands of years that said, okay, this works for this problem.
Wow.
It's like a formula.
Yeah.
And then you'll see on there too that I also have some written information about, hey, make these diet changes and that sort of thing. And a lot of that is what I've already talked about here with you.
Yeah.
This is, you can see it's like 0.
Okay.
Electricity comes out the tip and goes into your body and then travels back around and goes back into the device here. So like, I'm just barely feeling that.
Okay.
And then a 2, and then 3. You can maybe see my muscle jumping around there. But you can give that a try. And so that's actually down and this is up.
Okay. So like this would be a point, right?
Yeah. It's actually right there is one of the points.
Oh, I feel that. Okay.
You do?
Yeah.
Okay.
That's interesting.
When your acupuncture system is thrown off, it can cause lots of problems. And this is one way to help balance it. There's lots of different ways, but the formula is probably the easiest way. And if you just look that up, I recommend people do that about 15 seconds each point.
Okay.
And at the beginning, until you feel like, okay, I got stuff under control, like I would do it like every night.
Okay.
And I'm watching the news or the weather and I'm doing my points.
Yeah.
Or I'm watching a movie and I'm doing my points or whatever.
Okay.
Or in many cases, you can be like, okay, I'm having trouble. I'm having a problem. I'm having some anxiety or panic, or my stomach hurts. You could look up stomach problems in there too. There's lots of different symptoms.
Okay,
like I said, close to 100. And you can do it like, okay, my stomach's not feeling great lately. I'm going to do the points for stomach.
Okay.
Or
sweet.
Or whatever. So you've got access to that as well.
Awesome, thank you.
And I'd recommend that you do that on a regular basis.
Favorite tool,
Yeah. And it just takes a AA battery. It's a real simple device. Okay. So we look at blood in two ways. One way is the way everybody else looks at blood. And like I said, LabCorp, they're the ones who took your blood.
Right.
And they use essentially a statistical analysis to compare you to everybody else to see if you're having any problems.
Okay.
So they use a bell curve, essentially. And if you're in a situation where you're in the middle, they are like, okay, great, you're just like everybody else. And then if you're out to the side a little bit, this is called one standard deviation from the mean. This is like, okay, you're close to what everybody else is like, not so far away that it's bad. But then when you're out here, this is what they call two standard deviations from the mean. And this is like, okay, he's having some problems. Now, this analysis has some real good things and bad things with it. It won't find stuff that is like, minor. You got to have a pretty significant problem for this to show up.
Okay, gotcha.
Now, that being said, your blood tests are all normal.
Okay, that's good.
It is good, but then it's not good.
Yeah, because minor problems.
Because I'm having problems, but all my tests are normal. So, what the heck?
That's true.
And it's a great place to start, but not a great place to finish up. But we did a complete blood count, a comprehensive metabolic panel, and then we did a fatty acid balance test, which I don't have in yet.
Okay.
And we'll definitely let you know what that shows.
Yeah.
That one is like testing your omega-3s and trans fats and that sort of thing.
Okay.
And then we also did what's called lipid panel, which is like your cholesterol and triglycerides and your LDL and HDL and all that. Out of all those tests, you didn't have anything. Okay. So, great. That means you're not at least in a disease situation.
Yeah.
So good. But we take those exact same results and we plug them into what we call a functional health analysis. And what this kind of does is like squeezes in the sides of the tests so it shows things up earlier. Okay.
Yeah.
And when you see this, because you'll see you've got a lot of like, okay, I got a lot of red and yellow in here. That doesn't mean it's different than here. We're just looking at it in a different way that red flags it earlier. And so think of these like, these aren't necessarily issues you're having currently, but if you don't do anything about it, it's something you could have down the road. Yeah. If that makes sense.
Yeah, it does.
Okay. It's like catching it early.
Yeah.
And if you don't catch, what they do, diabetes is a great example. They're say, okay, well, you're here, you're normal. So we don't even worry about your diet. You're here, you're maybe showing some signs of problems, but it's not bad enough we're going to give you a medication. And they don't even bother talking about your diet. And then here, oh, you've got diabetes, here's your drug for the rest of your life.
Okay.
I'd rather say, oh, hey, you're starting to show some problems. Let's do some diet changes and take some vitamins and not get you on diabetes meds the rest of your life, just as an example of that.
No, yeah, for sure.
So we take all of this info and we'll talk about action steps here in a second. What it showed was that you possibly have anemia due to iron deficiency. Okay. That you've got possible cardiovascular health issues. Some of that can relate back to the omega-6s. Dehydration. Yeah. Now, This trace minerals will help that immensely.
Okay.
Have you ever heard of osmotic pressure?
By name before, but that's about it.
Okay.
Yeah.
It's like the ability of a fluid to hold on to water.
Mm.
So you put a bunch of salt in salt water, and it won't let it evaporate as quickly.
Okay.
Okay.
Yeah.
Just as an example.
Yeah.
But if you're low on minerals, your body won't hold on to water. You'll pee it out real easily.
Okay.
And then you sweat out minerals all the time and pee them out all the time. So we need them replenished.
Yeah.
And with the quality of our diets these days, we just aren't getting enough of that. So dehydration is a real problem. And it's not like you're necessarily not drinking enough water. Your body's not holding on to water like it should.
That makes sense.
If that makes sense.
Yeah, because I feel like I have been trying to drink more water, but it's like maybe it's not absorbing as much as I need it to.
And it gets absorbed, it just doesn't hold it.
Okay. Yeah.
So this will help. This will help that. And then according to the white blood cells, that there looks like there's some kind of chronic attack on your system. I want to do actually some more tests on that. And then it did show a zinc deficiency. Now, I didn't find that with the muscle testing, but it did show up with the blood tests.
Okay.
Now, each one of these is in the next about 5 pages.
Okay.
And it talks about like this iron deficiency anemia. Like this test up here is why we thought you probably had this. Okay. And then here's what you can do about it. And we're going to talk about action steps here. Same thing with like cardiovascular health and all the rest of them.
Yeah.
These are all things that are an indication that it could be causing this problem, especially down the road if you know anything about it.
Okay.
So, and I'll send both of these with you. But what I'd like to do now is to go ahead and kind of put this all together.
Gotcha.
And get kind of an action plan for you to help it, essentially. Trace minerals. I would recommend taking that every day. There's a couple different dosages. It says 1/4 to 1/2 teaspoon. Or you can do a 1 drop for every, I think, 10 pounds body weight. So however you dose it, I just tend to squirt it in the thing and shoot it down.
Yeah.
And I have gotten to the point, and you probably will too, where you're like, hey, I feel like I'm getting low on minerals. I'll feel like I'm less energetic than I should be. Or I'll be in a situation where it's just like, something's, oh yeah, I haven't taken minerals in a couple of days. I'll be able to feel it.
Okay.
So anyway, I would take it daily for now. In the summer, you got to do it a little bit more than in the winter because people sweat it out a little bit more.
That makes sense, yeah.
But for now, I would take it every day for sure.
Okay.
This showed that you were B vitamin deficient. I'm not going to have you get a B vitamin by itself. I'm going to have you get a supplement that is called DSF formula. DSF has a lot of B vitamin in it, but it also helps your stress handling. It helps all the stress handling systems of your body. It is designed to support the adrenal gland. Now, your adrenals didn't show trouble necessarily, but with the stress that you're under, I think it would be helpful.
Yeah.
I would take 2 tablets a day.
Okay.
For the gallbladder, I'm not going to recommend a supplement. I'm going to recommend that you do a liver cleanse. I think your mom did one. Did you ever do a liver cleanse?
I don't think so, but I wouldn't be surprised if my mom did one. I think she might have.
Okay.
She might know about it.
If you have a really good diet, which I'm hoping you'll change over to having a really good diet.
For sure.
And you sound like your diet's decent right now, but like I'd like to see you improve it.
Yeah.
Then, if you're doing one of these every year, you're doing great.
Okay.
I had a lady who she didn't want to give up her horrible. She loved Taco Bell. So, yeah, you can't hardly get worse.
Yeah.
But anyway, so she was doing like one of these every 6 weeks or so.
Oh.
that's not good.
Yeah.
But a liver cleanse can seriously clean out the liver and the gallbladder both. And I wouldn't be a bit surprised if that was a significant cause of some of the stomach trouble that you're having. I've had people do this and say, oh, that get rid of their stomach trouble. This can also relate to migraine headaches. Do you ever get migraines?
Very rarely with all this going on, yeah.
Okay.
Rarely.
Okay, good.
Yeah.
This can relate to migraine headaches as well. So the other thing that I'm going to recommend is called 5-HTP. Now, I went to Walmart and before you got here, and I was trying to find this stuff so I could test you for it.
Yeah.
They didn't have it.
Okay.
So you probably will need to go to a better grocery store than Walmart. Do you know where Natural Grocers is?
Yes.
Okay.
Yeah.
They're likely to have it, or you can get it at Amazon or whatever.
Okay.
Take it, and it'll depend on the dosage. Whatever you buy, I'll recommend one from NutriWest because I really know that one gets results.
Okay.
And this is from NutriWest as well. But you can pick this stuff up at any good health food store.
Yeah.
You want to take it in the evening. And you want to take it with a tiny bit of something sweet, like a bite of an apple or a bite of a banana, or something like that.
Yeah.
Tryptophan is an amino acid. It can be used for lots of different things in the body. It can be used for muscle. It can be used for all sorts of stuff. If you take it with a tiny bit of sugar, what it's going to do is the sugar is absorbed into the nerve cells easier than the other cells of your body, and it'll go in along with that is the goal.
Okay.
And what we want it to do is to be turned into serotonin. And like we talked about earlier, serotonin is that I'm good. I'm good.
Okay.
With a bite of I'm just going to put bite of an apple, but any kind of fruit would be fine.
Okay.
Bite of fruit. The reason you take it in the evening is some people, not everybody, but some people, when they take this stuff, it does a quick job, and you'll get I'm kind of tired now.
A little bit drowsy. Maybe.
Yeah, a little drowsy. So taking it in the evening is usually your best bet.
Okay.
So, have you heard after Thanksgiving dinner, you'll get tired?
Yeah, there's a term for it that we use. I think we call it the itis. It's just when you eat really good and you just feel like you got to sit down and take a nap or something.
Well, and one of the things about turkey is it has a very high amount of tryptophan in it.
Okay.
So a lot of times you'll eat that stuff, it'll turn into serotonin, and you're like, well, I got to take a nap.
Yeah.
And then being full, helps that too. But anyway, and then getting rid of the candida, I'm going to recommend oregano oil. I'm going to recommend 2 capsules a day. The one that I like the most is called Healthy Health.
My mom has that.
She does?
Yeah, she
Okay,
does.
Great.
She lives with that. She loves that stuff, yeah.
Okay. So what'd she take it for?
I would have to ask her. I don't know, but she has some of that.
Okay.
Yeah.
It's great. Usually you don't want to take herbs all the time. And if she's taking it all the time, that's probably not good. Usually you want to, my diet is so good, I don't have to take it all the time to keep the candida down because I'm not feeding it.
Right. That makes sense.
So I would grab a bottle of that, and then, and you can, again, they have it on Amazon, or you can actually call Healthy Health. They have their own website. Their customer service is great. But 2 capsules a day. And in your case, your candida doesn't appear to be really, really bad. So I don't know, maybe, especially if you have a good diet, like 60 days. And then stop.
Okay.
And then taking a probiotic can help immensely at restoring the good bacteria in your gut. You want to get the count in the billions. I like NutriWest for that as well. But you can also get like Solar Ray is a company at Natural Grocers in the refrigerated section.
Okay.
And you just look right on the label, and usually they'll say like 50 billion or something like that.
Right.
Yeah.
Okay.
You want it in the billions, and then this is one of those things that I recommend taking forever.
Okay.
Even if you have a good diet, it can be kind of hard on your good probiotics. So I would take 2 a day. And you want to take it not at the same time.
I was going to ask about that, yeah.
Yeah, because oregano oil kills bacteria, even the good bacteria.
Mm-hmm.
So usually you want to take it like 30 minutes after. Take the probiotics 30 minutes after the oregano oil.
Okay.
And then the other thing I'd recommend is omega-3s. You're already taking them.
Mm-hmm.
I'm going to recommend you up your amount.
Okay.
The test showed that you need more.
Yeah.
And then I'm looking forward to seeing what the blood test shows as well.
Okay.
But for...
Because I think with that, I've only taken just like once a day.
Okay.
Yeah.
Because even to get that dose, you need 2 capsules a day.
Yeah. Okay.
Yeah. So...
so you're taking the recommended amount. Okay.
And taking that is fine. But I'm going to recommend about 10,000 milligrams a day for about 2 weeks. And then 7,000 milligrams a day, milligram per day, for probably about 2 months. And then 5,000 milligrams a day for forever, into infinity. And then this is forever. This one, 5-HTP, it'll depend on the dosage of, and then it'll also depend on, like, okay, I have a really good diet. Do you eat meat?
Yes.
Okay, great.
Yeah, sure.
I think it's really, really important to eat meat.
Yeah.
Because there's not much else that has these amino acids in it that we need for so many things in our body.
Right.
So eating meat's really good. The other thing that I'm going to recommend, and this is like long-term being healthy, and that's a Paleolithic diet.
Okay. I've heard a little bit about that.
So essentially, here's your plate. Eat meat. Eat veggies. Small plate, fruit, and nuts. What's not on the Paleolithic diet? Sugar. Don't eat sugar. In general, other than some fruit, if it tastes sweet, don't eat it. If it's a drink that tastes sweet, don't eat it. Don't eat, candy or any of that kind of stuff's really bad for you. And then wheat or any kind of grains. Grains are full of omega-6s, or anything made with grains. Rice, pasta, cereal, tortillas, chips, corn's another one. Yeah, thanks, honey. And then dairy. If every once in a while you cheat with some dairy, it's not a huge deal. But, you get to the point where your taste buds reset. And if you have a pretty strict diet, especially at the beginning, that will starve out your candida and make all this hardware stuff that we're working on to be better.
Okay.
And then you'll be like, say you have a diet that is pretty, hey, I'm pretty strict.
Yeah.
And then you cheat and eat like, ice cream. A lot of times you'll be like, phew, I shouldn't have done that. Mm-hmm. Your body will let you know.
Yeah.
You know what I'm talking about. It's like you feel better already getting off fast food.
Yeah.
It'll let you know.
Okay. That makes sense.
But if you're just like, well, I eat fast food every day, so your body's like, well, I've been letting him know for the longest time. I'm used to this now. You just get used to the bad. Or like people who smoke cigarettes, it's the same thing. That first one you try, it's like, but after a while, your body actually gets addicted to it.
Yeah.
But it's still bad for you.
Yeah.
Your body just gets used to it. So, and it'll get used to whatever you feed it. So you may as well feed it the healthy stuff. And then the other thing I would really work on is the emotional release technique and the dynamic consciousness repatterning. Really get those to where they're like, hey, I know how to do this really well, and I feel like I'm in control of my situation. And then you'll be like, hey, my hardware is doing good. My pituitary's firing. It's throwing out serotonin when it's appropriate for my body. And then my emotions are doing good, and I just don't have trouble anymore. Okay. I know I'm hitting a lot of stuff here. Do you have any questions?
So far, no, not actually, no. If there's anything, I mean, obviously with the website and stuff you're giving me, that's definitely going to help me a lot. But so far, pretty good.
That I'll send you a link to that.
Okay.
It's accusmart.com. But I'll send you info on that, and then I'll point out I've got a couple of videos on YouTube that might be helpful. But then there's a ton on the site as well that goes through the lessons on all of this. Like, I mostly talk about eating paleo. I do talk about some of these other things, but then I have a whole section on emotion.
Right.
But what I want you to do is get to the point where you're like, I know how to do this, so next time I have trouble, I'll be in a situation where I know how to deal with it.
Yeah, for sure.
Yeah, and my suspicion, and I don't know exactly, but my suspicion is you probably ate something that your gallbladder didn't like. Gallbladder can be a real issue. It can cause a lot of pain. I mean, lots.
Yeah.
And you probably ate something, and then this, you're like, man, I don't know why this is happening. You go to the doctor, and he's like, you're fine. You're fine. We did a test and didn't see anything.
Right.
And you're not fine.
Yeah.
Because you're feeling bad.
Yeah, I don't feel
so fine. That does not help your anxiety when the doctor's like, no big deal. And you're like, I feel like it's a big deal.
Yeah.
I'm glad we're getting to the bottom of things.
Yeah, for sure. Definitely. Very helpful.
Do you have any questions?
At the moment, no.
Okay.
Honestly, really good at explaining everything.
If you have any down the road, let us know. I'm really pleased we didn't find any toxins. We didn't find that many emotions. We did find some, but I feel like you're going to get a handle on that. There's a lot of things we didn't find that will not be roadblocks that you have to worry about. So anyway. Okay. Well, great. Well, I sure appreciate you coming in. And
thank you, doctor.
And hopefully this will make a big difference quick.
Yeah.
So.
For sure, definitely.
And, I think in a lot of ways it helps if you have a plan.
Yeah.
Like I have a plan on fixing this. And so even if you do have stomach trouble, it's not going to be as like, worry. Why?
Not going to feel helpless.
Right. Yeah. Don't feel helpless. That's because if you do this liver cleanse, that'll clear the way to your gallbladder, especially if you don't eat badly after that.
So actually, I guess a question about the liver cleanse real quick. What exactly would I be doing with that?
Okay. It's on the website.
Okay, sweet.
It talks exactly how to do it.
Cool.
So essentially what you do, and it sounds kind of gross and it's not a fun cleanse, but it's very short. It's not even 24 hours. And it makes a big, big difference. I had a patient, I didn't anticipate you needing this, so I didn't put this in my in your PowerPoint because I didn't know you would need it. But I had a patient who, she didn't have the same kind of problem you did. She was in a situation where she had real bad, like, gallbladder pain. Like, you know, like my liver and gallbladder really hurt.
Yeah. A constant pain.
Yeah. Well, it would come and go, but here. And she did this same cleanse I'm going to recommend for you, and those are the gallstones she got out.
Oh wow.
Yeah. Some of them are, and that's a picnic plate. That thing that they're on is like a, you know, one of those paper plates.
Yeah. Those big ones.
So what you do with it is you drink a couple doses, and it tells you exactly how to do it. And then I have a video on exactly how to do it. So it's easy. It'll be easy for you. You set aside time because you can't go to work the next day.
Gotcha.
You want to do it on a weekend or something like that. You do a couple doses of Epsom salts, and they taste similar to this. They don't taste very good. Very minerally, but what the Epsom salts do is relax the tube that goes from the gallbladder to the small intestine.
Okay.
So the tube just becomes relaxed. It's got muscle in it, and those muscles can relax when they have a lot of magnesium, which is in Epsom salts. And then you drink, and it's all timed out. You do it on a schedule. You drink grapefruit juice and olive oil together. The olive oil is a fat, and it makes your gallbladder and liver produce a lot of bile and contract very hard to try to push out a bunch of bile into your small intestine to digest all this fat that you just drank.
Okay.
And then what happens is, because this tube is relaxed, any gallstones or any junk or anything like that that's in your gallbladder gets pushed out with it.
Okay.
And hers was like the worst case I've ever seen.
Yeah.
For sure. And I doubt you'll have that, but I have patients see gallstones floating all the time in the toilet because it'll give you diarrhea, but it's like short term.
Yeah. Okay.
So anyway, good question though.
Okay. Yeah.
All right. Well, real good. And if down the road you have any questions at all, just let me know.
Definitely.
Great.
Sure.
Thanks
Thank you,
very
Doctor.
much.
Of course. Thank you.